Hey guys, today we are starting a whole series on how to say no. It looks like you guys have a lot of questions about that, so we're going to kind of talk through some ways that you can say no, things you can say no to, kind of how that's going to go so that you feel comfortable about doing it when you're in the hospital. We're going to start out our refusal series today with IVs because that's something that a lot of you want to refuse. So we're going to go through 3 different scenarios that you could use to refuse an IV. So I come in the room and I say, hey, Mrs. Brown, it looks like your doctor has ordered an IV and I'm going to go ahead and put that in. Is that okay? And you say, oh, I've talked with my doctor in advance and I really don't want an IV. So then your nurse says, okay, well, your doctor didn't note that, but you're not having any induction agents. You don't want an epidural. You don't want IV pain meds. So it looks like we don't have to put in an IV, but I'll let your doctor know just so he knows. Okay, you're going in to refuse that IV, but this time you're scheduled for an induction. So the nurse comes in and says, hi, Ms. Brown, we're going to start your induction. I need to start an IV so that we can get things going. Oh man, sorry about that. I don't want an IV. Well, you are here for an induction and we have to have an IV in order to start an induction. So I guess your choice is to either refuse the induction or to get the IV. I can talk with your doctor, he can call you and we can refuse and we can talk about that, but I wish they would have talked to you about this in the office. You're gonna need an So you can either refuse the induction or you can refuse the IV, but according to policy and according to our professional organization, you have to have an IV in order to get an induction. So things like that are gonna happen. If you wanna eat, you might not get a C-section. It's your choice, your choice. Third way a refusal can go down. Hi, I'm Hillary. I'm going to be your nurse today. Your doctor has ordered an IV, so I'm going to go ahead and put that in. Is that okay? Oh man, I didn't know I needed an IV. I really don't want one. Okay, well, what are your concerns about the IV? Why don't you want one? I just really hate needles, and the thought of that tube being in my arm all day while I'm in labor, I just can't take it. Okay, yeah, that's fair. Did you know that the needle comes out, it doesn't stay in your arm all day, and we can actually just have a little tube that hangs out in your arm. You don't have to be attached to the tubing. Okay, that sounds doable. I guess I'll take. So about refusals, I just wanted to show you guys that when you refuse one thing, sometimes there's a cascade of other things that you end up refusing as well. And sometimes you decide that you do want that thing because we've educated you. And that's really the nurses and the doctor's job, is to educate you so that you can make the best choice for you and your family.